Hello, my name is Dr. Young Tai Lee. I have been practicing internal medicine in Los Angeles for the last 30 years. Today, I would like to talk about Covid-19, coronavirus, its solution and possibly answer to all this crisis. This crisis, we have to work together. Me, you, the doctors, the pharmacists, pharmaceuticals, and the government. We all have to work together in order for this idea to work. First, let's look at this graph. This graph is from Wikipedia, 2020 coronavirus and pandemic in South Korea. Date, March 25, 2020. In Korea, we have 9,137 cases, positive cases of COVID-19. Out of this, only 126 people died. The rate is 1.38%. But let's look at it in more detail. The age. Also, you could see here, young people, under 20 to 29. There are a lot of people, as you could see, 2,475, which is number one. But death rate is 0. Nobody died. Only people who died are older people. As you could see here, in 30s, the rate is 0.1%. In 40s, rate is 0.08%. Okay, around 1%, 0.1%. In the 50s, the rate is 0.58. So it's half of the 1%. In 60s, the rate is 1.73%. In 70s, 6.4%. But the 80s is over 13%. And also, if you look at this from CDC report, people with cardiovascular disease, diabetes, chronic respiratory disease, hypertension, cancer has a very high death rate. So most likely people who have disease and older people are likely to die. And younger people, healthy people, are not likely to die. President Donald Trump said, these two medicines, azithromycin 250 milligrams and hydroxychloroquine 200 milligrams are helpful in treating coronavirus or COVID-19. And Tamiflu and Lumentidine I have added. But now, as you know, we don't have enough medicine. As a doctor in LA, if I try to prescribe hydroxychloroquine, they don't have it in the pharmacy. Even azithromycin, it's very hard to get. So the problem is we don't have medicine. So we got to make medicine fast. Either government sponsor it or pharmaceutical donate, whatever. You have to make lots of pills. Okay, let me give you how many pills. There are 300 million people live in United States. And 80% of the people don't have any symptoms. Only 20% of the people has symptoms. So these 20% of the people we have to treat. So those are 60 million people. So you need 360 million pills of Tamiflu, 360 million pills of azithromycin and 900 million pills of hydroxychloroquine. That's a lot of pills. And also, how are you going to distribute all these pills to symptomatic patients? They all need prescription, right? Doctors cannot handle that. Too many people at one time. So I think for two to 3 months, after we have the medicine, it should be non-prescription drug. Not for a long time, just for 2-3 months. So we could have it in our pocket whenever we need it. And also, all the diseases, especially common cold or flu, you have to treat early. If you treat early, your symptoms go away right away. You don't become very sick, usually. So when you have malaise, a little rundown, don't feeling well, you should start taking it. Take the medicine. And take Tamiflu and azithromycin right away. And when the symptoms get worse, let's say you get fever, chills, and then productive cough, then you have to start hydroxychloroquine. As prescribed here in detail. So what we need to do, first we have to have this medicine in hand. Then everybody go outside. Do normal life, normal work. Go to church, go to restaurants. And when they have symptoms, start taking medicine right away. But I'm not talking about older people or sick people. They have to stay home. Over 60 years old and people with diseases, they have to stay home. But you don't have to stay very long, maybe 3 months. Then it will be all over. Or else, if it lingers on for a year or two, you have to stay home for 1 or 2 years. That's more crazy, I think. So my solution is treat early, have people ready to take medicine, and medicine be available. And when you're really sick, definitely you have to go to emergency room. If you're short of breath, coughing too much, high fever, definitely, then you need to go to emergency room. But if you treat early, most likely your symptom will subside and you'll get cured. So this is my solution. This is my opinion. So please, I think this is a good solution. Thank you.